Hi, my name's Peter. I'm a podiatrist from Shoes, Feet Gear. Today we're going to talk about the importance of the glute muscles in stabilising the hip and the knee with running. These muscles on the outside of the hip are very important for keeping that hip nice and stable and nice and level when running. If they're not strong enough, then the hip drops and the knee will collapse inwards as well. To compensate for that, things like your ITB will have to work very hard to try and create some stability, and leads to a lot of the ITB frictional syndrome or ITB issues. So when we're testing for just glute strength, one of the things we do is get people standing on one leg with their knee over their toe, hips nice and level, hands on the hips, and just doing a small single leg squat. And we're trying to keep that knee straight over the toe and keep the hips nice and level. People with weakness through those glutes, very weak, they'll find the knee will collapse inwards or the hip will drop to the side, and sometimes both. With running though, we normally have a lot more impact going through our body. So another way to test that is through a little single leg hop. So we get into the same position and just single leg hop, and trying to maintain that hips nice and level and that knee. People that are quite weak through there will do the hop and then collapse down and fall over. Also, we usually test for fatigue as well, where we do that same position and then we just go down into that squat, and we get people to hold it for about 30 seconds or a minute until fatigued. And as they get tired and fatigued, hip will drop and the knee will start to collapse in as well. So glute strength is one of the important things. The other things for ITB, overuse injuries, or frictional syndrome is also engaging those glutes with your run technique, and also with your foot pronating and causing that knee and hip to internally rotate.